Hi, my name is Rachel Bryan. I'm a nurse practitioner student at Auburn University, and I will be giving you an educational presentation on anxiolytics. There are 3 drug groups within the pharmacology class of anxiolytics. This includes benzodiazepines, serotonergic anxiolytics, and barbiturates. There are many drugs included in the benzodiazepine group. Here's a list of drugs such as alprazolam or Xanax, and lorazepam, or Ativan. Of the serotonergic drugs, buspirone is the only drug approved for use in the United States for the treatment of anxiety. This drug group will be referred to just as buspirone for the remainder of the presentation. There are also many drugs in the barbiturate group, such as phenobarbital. This is not to be confused with another drug in this group, pentobarbital. The action of anxiolytics largely depends on the drug group. In short, the drug groups act on the GABA neurotransmitters and serotonin receptors. The main therapeutic effects on anxiolytics is to treat and/or reduce anxiety. Here, you can see the pharmacodynamics of all 3 drug groups. They all act differently in the brain, but ultimately are giving the same result, and that is to reduce anxiety. For all 3 drug groups, the pharmacokinetics are similar to each other, with its absorption, distribution, metabolism, and excretion. All 3 of them are absorbed via the GI tract. The distribution can vary somewhat between the 3 groups. They are all metabolized through the liver and excreted through the urine and feces. Next, we will discuss precautions and contraindications for each drug group. A huge precaution for benzodiazepines is that there is a high concern for dependence. Another precaution is that you do not want to abruptly discontinue or withdraw from the drug. A precaution for buspirone would be to assess the drowsiness level before use in situations requiring cognitive and motor alertness. Contraindications for buspirone would include hypersensitivity, hepatic or renal disease, and for the treatment of panic disorder. Precautions for barbiturates would include to avoid alcohol use, to use caution in patients with history of depression, alcoholism, or suicide attempts, and in women of childbearing age. Barbiturates are contraindicated in children younger than 6 years of age, those with severely impaired liver function, nephritis, impaired pulmonary function, or if they have a history of dependence on barbiturates or other hypnotics. There can be many adverse drug reactions for both benzodiazepines and barbiturates. However, the main reactions to be aware of is excessive sedation and CNS depression, including cardiac and respiratory depression. On the other hand, buspirone has very few adverse drug reactions. The most common include lightheadedness and headache. Here, you can see the most common drug interactions for each drug group. For benzodiazepines, they can interact with digoxin and TCAs in the body, so it is important to check the blood levels for both. For buspirone, if it is used with MAOIs or SSRIs, that increases the potential risk for serotonin syndrome. For barbiturates, there is a risk of CNS depression with concurrent use of antihistamines, alcohol, benzodiazepines, and MAOIs. All 3 drug groups are used to treat and reduce anxiety. The clinical use for barbiturates can include the treatment of different types of epilepsy and the use of pre-anesthetic sedation. The drug rationale for these drugs can depend on the patient's symptoms and the prescriber's preference. For benzodiazepines, most all of the drugs are equally effective for the patient. Clonazepam is a drug of choice if long-term treatment is warranted, and diazepam is the drug of choice for the treatment of status epilepticus. For barbiturates, it is not the first-line treatment for medical emergencies. However, phenobarbital can be prescribed in low doses for epilepsy. For monitoring the patient on benzodiazepines, if they are taking a TCA or digoxin, it is important to monitor both of these blood levels while the patient is on the benzodiazepine. It is also important to monitor the liver function and CBC counts with long-term use. Fortunately, there is no strict monitoring for buspirone. For patients on barbiturates or benzodiazepines, it is important to educate them on avoiding alcohol use while taking these medications. It is also important to educate the patient to not abruptly withdraw or discontinue from taking these medications. For the patient taking buspirone, it is important to educate them on the prolonged onset. It takes about 1 to 2 weeks for the medication to start working and takes up to 6 weeks for the patient to feel maximum effects. Here you can see the main takeaways from this presentation. Do not abruptly stop taking benzodiazepines and/or barbiturates. Benzodiazepines and barbiturate use means there is an increased risk for CNS depression and sedation. Avoid alcohol with benzodiazepines or barbiturates. Buspirone max effects take about 6 weeks. I hope you enjoyed this presentation on anxiolytics and are able to walk away with a better understanding of how these drugs work in the body and how they treat anxiety.